Thank you.
And we have to move on to some other subjects because registered and bonded allied health professionals from the College of Health, Kintampo, and the School of Dispensing Optics, Oyoko, through this medium, then they announced a final resort to picketing at the premises of the Ministry of Health this morning, and my colleague is there. They say the action has become necessary since all effort to get the attention of the ministry to post them or give them some postings has proved futile so far. Maxwell Agbagba is there live on the ground. Good morning to you, Maxwell. And so far, what has been the atmosphere, especially when we know that the nurses are picketing this morning?
Exactly, Roland. Good morning to you, Roland. Now, as you rightly mentioned, we currently at the premises of the Ministry of Health. If you remember, some weeks ago, members of the coalition of bonded unemployed diploma nurses picketed outside the premises of the Ministry of Health. Today, if you see these group of nurses, health professionals behind me, they are actually not part of the bonded unemployed diploma nurses. This is actually a new group picketing here. They are part of the group called the Coalition of Unposted Bonded Allied Health Professionals. They are picketing here today. In fact, they released a statement on the 7th of May in which they made a subtle admission that for their colleagues who picketed here some weeks ago, they have had, some of their demands met. In fact, we pick indications that the Ministry of Health has made moves and that financial clearance have been done. So on the 1st of July, the group that picketed here about 2 weeks ago will be starting work. So this new group are also picketing here to demand that they are posted immediately. Roland, when you come here, in fact, you can see them with their bags. They came really prepared. Some of them came with their sponge, some of them with their towels, with their bags, with extra, clothes, with their beddings, all of that here, and they are ready to sleep here until their demands are met. In fact, some of the ladies standing here actually came here with their daughters, with their sons, some of them as young as 2 years old. But I have the president here with me, the president of the group, Solomon Yeboah. He's going to tell us exactly why they are taking this action and why they will not wait patiently for that financial clearance exercise by the Ministry of Finance to be carried out. You're welcome, Solomon.
Well, thank you very much.
Now, before we delve into the conversation itself, tell me about your coalition and the kind of professionals who are made up.
Okay, our coalition is aligned health profession, and currently over here we are with the health assistant clinicals and then community health nurses. Now, the coalition is made up of unposted, bonded allied health graduates. That is a coalition. Our problem is very simple. We have sat in the house for 9 good months. 9 good months sitting in the house. Myself and my executives, day in and day out, we come to the ministry here, we sit with the director, we've met with the Honorable Minister of Health, to discuss issues with regards to employment because we are bonded. Assurance upon assurance have we been given. We've waited for several years because we believe in the principle of democracy. We believe in dialogue. We never had any idea of picketing even at the premises of the ministry. Now, upon everything, upon all our discussion, upon all our petitions, upon all our grievances that we presented to the ministry ended up betraying us. Meaning that when our colleagues, our co-colleague health trainees came here to picket on 1st of July, their clearance had been given to them. Once we sit down to dialogue with them on a peaceful ground, they don't need it that way. So we see to it that is what the ministry inquires from us, for us to picket before they give us our clearance. That is why we are here this morning.
Now, you call it betrayal, and you stated in your preliminary remarks that you've contacted the Ministry of Health. You've done a lot of follow-ups. How many times did you contact the Ministry of Health, and how many meetings have you had with them?
The meetings are uncountable. On 24th of April, that we presented our 6th petition to the ministry. 24th of April, that we present our 6th petition to the ministry. Aside that, we presented our first release, telling the ministry that we've given them an ultimatum of 2 weeks. If nothing is done about our clearance, we have no other option than to picket at the ministry. A day before that, our co-colleagues came to picket over here. We met with the director, and we're having a peaceful dialogue, a positive talk, And he even informed us that we don't have any case because our population is just few. We are just little in
about 400, little
about
over 400.
about 495.
Okay.
We are just little. But you release clearance over 4,000 and you ignore us. And what even baffles us most is when we came to confront the ministry in relation to that, and we went to finance to find out, we were informed that they don't even know if our file has gotten to the finance ministry. We made an attempt to call the Honorable PRO of Health, the PRO, and when we were talking to him, the issue he told us was, the issue he informed us was, because we are allied health professionals. So today we are here. We are not leaving an inch. We are going to stay until our clearance is given to us.
This is more like, a very entrenched position that you've taken.
Oh, yes.
That in your own statement, you made a subtle admission that you are picketing here because your colleagues did the same, and their request, was actually met. Yes. So you're also doing the same because of that.
Oh, yes. We are doing the picketing, not necessarily because our colleagues came to do the picketing. Because if it had been our intention to picket, we would have done that long ago. Because for 9 good months, we have been with the ministry, trying to negotiate, dialoguing with them, presenting our petition upon petition to them. If it had ever been our intention to picket, we would have done it a long time ago. Our colleagues came here, and even the day they came here, we were with the director of the human resource, having a positive dialogue, a peaceful dialogue, and assurances were given unto us. But because they came to picket, over 4,000 has been released, and just our small population, we have been ignored.
Are you ready to endure the harsh conditions here? Your colleagues who came here, some of them had to, sleep in the buckets of parked vehicles here. Some of them had to, are you ready to do it?
Yes, as we are here, you can hear from my people. We are here to fight for our rights. We are here to fight for what legally belongs to us because we are bonded. And until our clearance is released, because if the ministry can release over 4,000 clearance just within 2 weeks, just because a day some health trainees came to picket, then we don't see any difficulty for they releasing 495 clearance in a single day. And until that is done, we are not leaving these premises. We are going to stay here. Nothing will cause us to leave these premises.
But you'd agree with me that before you get onto the public sector payroll, some financial clearance needs to be done, and that's what the ministry has been talking about for a very long time now, and you should understand that.
We understand that situation perfectly. That is why when the first clearance was released in February, we were not included, though we were due, but they ignored us. Yes, we came to them as their children. You see, we came to them, we spoke with them, and as they talk to us, we see them as our fathers. We see them as our leaders who make decisions for the country. So when the first clearance was released, we came to them, nothing was done. We still continued with our positive dialogue. And yet the assurances were still given. And now you release over 4,000 clearance again, and you've ignored us. Just because some people came to picket just for one day.
Just so we are clear in our mind. So you were saying that until that financial clearance is given, you are not leaving the country.
As you can hear from my people, we are not leaving. We are going
even for 10 days. You're going to stay.
We are going to stay here. We are going to stay here because we prepared ourselves before coming here. As you can see, most of our colleagues here, they have their sponges and other stuff over here. Our clothes and the rest.
Okay. Great. Thank you very much, Solomon Yeboah. He's the president of the coalition. In fact, I have some nursing mothers here with me. I want to speak to some of them. Where are the nursing mothers? Okay, they are standing a bit far from where I am. I want to find out from them how they want to endure this condition with their children. Why they deemed it prudent to bring their babies here, even when they are trying to, bargain their posters. Where's the mother? Okay, the mother here is not around, but this child, okay, we're not going to show her face actually, came here with the mother, and about 2 of them are actually here. As I mentioned earlier, some of them came here with their beddings, with their sponge, with their towels, everything ready to sleep here. And that's what is happening here, Roland, from the Ministry of Health.
Great insight into all the activities that are happening currently at the Ministry of Health. But have they been able to speak to any official there?
Well, Roland, as it stands right now, they just arrived here at the premises of the Ministry of Health. Some of them came from Bolgatanga, some of them from Kumasi, from Kintampo, from Sunyane Breku. And they all just arrived here, you know, some minutes ago. So as it stands right now, they've not had any interaction with officials of the Ministry of Health. As it even stands right now, personnel of the Ministry of Health are now arriving at their various offices. So as they wait here, hopefully they'll get a chance to have interactions with possibly the Chief Director or the Public Relations Officer or the Minister of Health himself. But as it stands right now, they've not had any official communication with any official here at the Ministry of Health as it stands right now, Roland.
So just like the previous group, if let's say their issues are not addressed today, they'll have to sleep there?
Yes, Roland, the president, rightly mentioned so, and a lot of them in an off-record conversation with them, they tell me that they are really committed to doing this because they do not understand why the other colleagues had to picket here for just 2 days, and their demands were actually met. In fact, they said they received the news with a lot of, maybe I should say trepidation. They were shocked when they got the news that, okay, the postings have been released and about a little over 4,000 clinicians have been given the financial clearance, but they have not been given the clearance to start work. As it stands right now, their colleagues will be starting work on 1st July, but they are still at home. They say that they've spent about 9 months at home doing nothing. So they are taking a cue from what their colleagues did, and they are determined, to do so. And if their request is not met, they're going to stay here till that, to that demand or to that request is met. In fact, I asked them whether they're going to do this if it's going to take them 10 days. They said yes. They said yes. If it's going to take us 10 days, staying here to make sure our requests are met, we're going to do it. As you can rightly hear, one of the ladies here is saying that even 1 month, they're going to stay here. So it looks like they are determined to do this in spite of the harsh conditions. Possibly they'll be here. Even as it stands right now, it's really hot here, Roland. And I'm sure you can see me drenched in sweat already, but they are determined to do so, Roland.
At the end of the day, before I let you go though, how many of these groups do they think are around or scattered across the country who could also come to picket sometime if their demands are not met? Quite baffling.
We don't go agree. We are not going anywhere.
Hello, Roland.
Yes, I'm asking how many groups of such students or how many groups of such bonded allied health professionals, so to speak, are there across the country who could also come to the premises of the Ministry of Health and picket?
Okay, so Roland, for what we know, the other group, that's the coalition of unemployed bonded diploma nurses, we know their number was a little over 900. This current group here, we know their number is 495. Not all of them are present here at the moment. So it looks like they are scattered all across, the length and breadth of this country. And as I already mentioned, they came from different parts of the country here to push that this request is granted by the Ministry of Health, and this this financial clearance action is expedited on this financial clearance. So they're scattered all across Ghana, but we know that as it stands right now, about 4,000, a little of about 4,000 nurses have been, given the clearance. About 2 days ago, they've been given the clearance to start work on the 1st of July. Yes. So it looks like these are members of, another group who are waiting for their postings to come. In fact, I gather from the president that there are some people who are also part of their midwives. Tell me more about them.
Okay, they are community health assistants, clinicals, and then we have community health nurses. They are also facing the same challenge as we are also facing. Yes, we thought we were the only people whom the ministry ignored, not knowing our co-colleagues as well, who have also completed their service for long, have also been ignored. Meanwhile, some people you see, what even baffles us most is our co-colleagues who completed their service last month, and we don't know how the trend that it took, because those who picketed over here were less than 1,000, but the clearance that was released was over 4,000. So the question is, if 1,000 was even given to those who picketed, the rest of the 3,000 plus, which people cover that area? Yes. Which people cover that particular area of that clearance. Our documents are viewed in the ministry for the past 9 months, together with our community health nurses and then health assistant clinicals. And you've rejected us, you've ignored us, just because we believe in positive dialogue. Today we are also here. We are going to picket. Nothing will cause us to leave these premises. And until our petition is met, until our clearance is given, nothing will cause us to leave these premises. We are here. We will sleep here. We will stay here because we are well prepared before we came here. So nothing is moving us.
So Roland, you just had the president once again reiterating their unwavering, resolve to stay here until they are given that financial clearance here at the Ministry of Health. So it looks like they're going to stay here. For some days, so we can, envisage, and that's what's happening here from Ministry of Health, Roland.
Constantly, I've detailed you there by my own veto powers. You are going to be there. Please make sure that you send for a mattress. If you don't have one, we can order one for you. Tonight, you'll be there. On Prime, you're going to give us the latest from there. Well, so thank you, Maxwell Agbagba.